And all new at 6, nearly all cancer centers are struggling with a nationwide chemotherapy drug shortage.
Yeah, this is forcing some people to get resourceful. Megan Schiller talked to Allegheny Health Network and UPMC about the impacts locally.
This has the potential to be a life or death situation, but the doctors I talked with said we're not there yet. Inside Allegheny Health Network's Cancer Institute, people are fighting. But now doctors say one of the best weapons to beat certain cancers are in short supply.
We've known the shortage was coming since February. And so way back when, we actually began to consider what were the options.
Oncologist Dr. Nathan Bahari says because of that, Allegheny Health Network is far from scrambling, but news of these shortages is sparking some tough conversations.
And I say, your cancer's fine with this. We're going to be able to substitute it, or don't worry, we're not substituting it, right? We've put aside, we've put ahead, there is a supply for you in this curative situation, and we are going to have your back.
Take a look at your screen at the drugs in short supply. Cisplatin, 2 out of every 10 cancer patients take this one. Carboplatin, methotrexate, doxytaxel, generic drugs that help treat a range of cancers. The shortage dates back to January when one of the largest plants in India ran into quality control problems with half the supply. And it calls into question, why can't we make these drugs here?
And whether it's, increasing, reimbursement so the margins are greater, increasing production lines, even allowing the expiration dates to extend.
The FDA is likely going to allow a shipment of the drugs from China through Canada, but he says it's not enough.
Most of the large cancer centers around the country are concerned that if the supply dries up, unfortunately, there are patients with curable cancers that without this drug could potentially die.
That's why he says this shortage is a wake-up call. Doctors say if you are concerned about how this shortage could impact you, first start with a conversation. Talk about your options instead of just having anxiety about the situation. And also, if you're concerned about this and not suffering from cancer, you can put pressure and call your local lawmakers and ask them to put pressure on the FDA to make changes. Reporting tonight, I'm Megan Schiller, KDKA News.